My clinical commissioning group is a group that's serving about 250,000 patients. It's made up of 37 member practices, and we're here to improve the health and healthcare for our local population. Our vision, and we're very much working with the local authority to have a shared vision, is to be the best, so to deliver the best health, the best care at the best value for our local population. Well, now that the NHS bill has been passed, we're now on the road to becoming a formal clinical commissioning group, which means we'll be accountable to the NHS Commissioning Board for delivering those things I talked about, good quality healthcare at the best value. We've worked with local GP practices, the local population, and scrutinised something called the Joint Strategic Needs Assessment that sets out the health needs of our population, and have come up with 6 clinical priorities that we're going to be focusing on. The first of those are the big 3 killers, if you like. What is it that's causing people to die early within this area? And they are cancer, mental health and heart disease. Then we've forecast 3 issues that are emerging in our population that we really need to tackle. They are alcohol, dementia and diabetes. So they form our 6 clinical priorities. We've also come up with what we're calling 4 essential programmes of care, things we've just got to get right. We need to really make sure that children have a really good start in life. So how do we get our children as healthy as possible? How do we care for people in old age? When you're older, you become a lot frail, and we've got to really focus on that. We've also got to make sure that if you're ill unexpectedly, we deal with that very quickly and effectively, and also make sure that if you're going into a hospital for an operation, that you're seen and treated as quickly as possible. And we're calling those our 4 essential programmes of care. Well, we think it is different, and we want it to be different in the right way. I think there's a really strong legacy that we're building on from NHS Western Cheshire, which was our predecessor primary care trust. But this organisation is trying to do a number of things. Firstly, and more importantly for us, is to put patient experience at the heart of everything we do. That's both from consultations with GPs in their clinics, right the way through to what are the priorities we're going to set. So it's really important that we're putting the patients at the heart of our decision-making process. And then to do that, we want to put clinicians in the driving seat. Particularly local GPs have got a huge amount of knowledge because of the patients they see in their surgery, at their home visits every day. Building on that knowledge and expertise has led us towards the 6 priorities that we have for our organisation, and we think that that's a real difference in the way that the NHS will operate. It's a really important relationship because in setting up our organisation, we wanted to develop a small focused management team. So we've constructed a small team who will work most closely with the clinicians, the GP leaders that are at the centre of our organisation. We then stood back and thought there are some other management functions, some of which need to be wrapped around us and done very close to us within the locality, and people there who understand our business, understand the changes that we're driving for. But as well as that, there are some things that I guess we think can be done at scale. So they don't need to be with us in the same building. They probably don't even need to be local. They probably, in fact, could be done anywhere. And we believe there's efficiencies to doing those things at scale, and we want to work with the commissioning support organisation to get that done. The reason that we believe in some of these changes is we want them to be of benefits to the local population. Again, we want to focus on the things that are going to make the biggest difference to our local people. That's tackling the big challenges of cancer, heart disease, mental health. What we want to be able to do is then to say there's some of the governing the organisations, getting it running effectively, and we believe that doing that with a commissioning support organisation frees us up to concentrate on bigger changes that we need to deliver here.